Hello and welcome back to Prepared SLP Graduate Apps 101. Lesson 1.2, still in the unit 1 of what is an SLP. So quick overview of this unit, we'll be talking about ASHA, or the American Speech and Hearing Association, things about where can I work, is it worth it, and then your carryover task for this week. So what is an SLP? According to ASHA, a speech-language pathologist is someone who helps treat different areas of speech disorders, language disorders, cognition, and swallowing. ASHA itself is a governing organization amongst SLPs. So in order to receive your certification, you have to be a member of ASHA, you have to pay your dues annually, and ASHA also helps kind of govern what types of courses you have to take in undergraduate and graduate school. They also advocate for a lot of things for us as SLPs. And they provide us a lot of different resources. So as you walk throughout your journey as an SLP, you'll become very familiar with ASHA and what they have to offer. Getting into where can I work? So this is going to be the bulk of our information for this unit. We as SLPs, as you can see, can work in a lot of different settings. Schools, pediatric clinics, all the way down to adult neuro clinics. Lots and lots of places that we can work. We're going to really break down each setting and a little bit of information about each. So schools, a typical day includes individual or group therapy. You might be seeing kiddos with autism, articulation, developmental or language delays. You might also be doing things like hallway duty or attending IEP meetings. There's a lot of different hats that school SLPs have to wear. Median salary for kind of the academic year ranges from about $63,000 to $75,000. As I go through these salaries, keep in mind that this is dependent upon what region you're in, what type of school you're working in, or even just the setting you're in, period. Pros, wide range of diagnoses. You'll be seeing a lot of different kiddos throughout the day, different ages. You kind of get to manage your own schedule in terms of what kiddos you want to see during the day, who you want to pull from the classrooms. And then you also get that time off. So summer's off, holidays off. Pretty big perk if you ask me. Cons, things like limited access to other SLPs. So if you're the only SLP in your school, it's hard to have that lack of somebody to kind of bounce ideas off of. You might also have high caseloads and high productivity standards. And depending on how many hats you like to wear, again, you'll be doing a lot of extra things besides just being an SLP if you're working in the school setting. Pediatric outpatient clinics, typical day in a peds clinic, about 30 to 60-minute long sessions. Again, working similar with those patients of articulation, speech and language delays, autism, feeding and swallowing. You'll also have time to do paperwork. Median annual salary is about $77,000. Pros, again, you get to see a wide range of diagnoses. Most likely, you'll have a little bit more access to other SLPs. You might even have access to some PTs and OTs depending on the clinic you're in. You also have increased chances of kind of specializing in certain areas. So whether that be specializing in working with kids with autism or in feeding and swallowing disorders, using that clinic to kind of help you specialize and see more of those patients. Cons, you might have variable pay due to no-shows and cancellations. So something to keep in mind is oftentimes these types of clinics are not salary-based, they're hourly-based. If your kiddo no-shows, you don't get paid for that time. You can do your paperwork, but you're not going to be making that cash. Also, you have to consider the after-school hours that many of these clinics cater to. If you don't mind having a longer day and working, say, 4 days a week instead, great, that's a thing for you. But do know that you might be working later into the evening if you work at a pediatric clinic. Pediatric hospitals. Typical day includes interdisciplinary rounding with doctors and nurses, PT, OT, etc. Completing evaluations and treatment, going through instrumental assessments, so things like fiber optic endoscopic evaluations of swallow or modified barium swallow studies. You might also be doing a lot of family education as you're seeing the kiddos in the hospital. Median annual salary is about $90,000, so it's on the higher side. Pros include you get to prioritize your schedule. Say, I want to go see this patient today, or maybe I can wait to see this patient until tomorrow. You get to see a lot of acute cases. You have access to instrumental assessments. So again, those swallow studies, things that you might not get the chance to do in a peds outpatient setting or in a school. Cons, the limited availability. These jobs are pretty hard to come by when it comes to pediatric hospitals. And you probably are going to have to split your time between inpatient and outpatient. Again, that might be a pro for some people if you like to vary your day, but if you're more one-track minded, this might not be the setting for you. Home health. So this is where you can complete both pediatric or adult therapy. Typical day includes preparing your schedule, traveling between homes, and then completing treatment, doing your paperwork, etc. Median annual salary is about $78,000. Pros, again, you manage your own schedule. You set who you're going to be seeing that day, call the patients to make sure that you can stop by their home. You also get a functional therapy environment. So this is something that I think is a huge pro of home health. You get to see where this person is living, what kind of communication situations they're going to be in. If you're working on feeding and swallowing, you can see what they have in their refrigerator and what kind of utensils they're using in order to eat. The pay is also pretty good when it comes down to it. Oftentimes people will reimburse you for that mileage. Cons are things, again, like inconsistency in your schedule. Some days you might have patients, 5 out of 7 say, you know what, I just don't want to be seen at home today. So your day kind of falls apart and it might be too late to rearrange your schedule or your travel plans. The other thing is the travel itself. So personally, I'm not someone who likes to drive a lot. I want to get where I'm going and stay there for the day. With home health, you're traveling a bunch. So if you aren't much of a driver, this might not be the place for you. Acute hospital. So this is where I did my clinical fellowship over at the University of Iowa Hospitals and Clinics. Typical day includes assessments, instrumental evaluations, interdisciplinary rounding and collaboration. It's a great setting. I really found my love of speech pathology when I was in the acute hospital setting. The median annual salary is about $88,000. Pros include that it's a fast-paced environment. So if you like to be on the go, make sure that your day goes by fast, this is the kind of place for you. Again, you get to manage your own schedule. So you have a list of patients you're seeing. You can say, I know this person needs to be seen today, or maybe I need to put this person off until a couple days from now. You also have access to those instrumental assessments. And again, you get that interdisciplinary collaboration with doctors, nurses, and other staff. Cons, it can be a very high stress environment just because you are working with people who are quite sick. It might have lower pay depending on where you are. And then for me, the biggest con was working the weekends. So typically in an acute hospital, people have to work weekend shifts. So 1 or 2 days a week, or each weekend, once a month. So keep that in mind. If you're someone who loves your weekends, again, this might not be the place for you. Inpatient rehabilitation. So this is maybe a step after the hospital. Someone still needs intense care, more therapy. They might go to inpatient rehab. Typical day includes more assessments, mealtime observations, interdisciplinary collaboration with PT and OT, group therapy, and paperwork. Median annual salary is about $79,000. Again, a pro is that it's fast-paced environment. You manage your schedule, it's interdisciplinary, kind of similar to a hospital setting. You also see your patients for a little bit longer than you would in the acute setting. Cons, intensive therapy. So with being able to see them more often, pro or con, depending on who you are and how much you like to establish that relationship, but you will be seeing these people more frequently throughout the week in inpatient rehab. You also most likely have to work weekends, same reasons that I stated about the acute hospital. Not my favorite aspect of either of the settings. Skilled nursing facilities. So typical day in a skilled nursing facility, evaluations, treatment, meal observations, educating staff in terms of what your recommendations are for certain patients. Median annual salary is about $91,000. Now keep in mind, skilled nursing facilities are probably the highest paying setting that we have in speech therapy. That being said, pros include prioritizing your schedule, establishing those relationships with patients. The pay is a big one. Cons, with that higher pay comes things like productivity standards that are quite high. So here's how many patients you have to see in a day, or how many minutes of therapy you have to get in per session. These can be slightly unattainable depending on where you are in the setting and which skilled nursing facility you're working in. People have kind of mixed feelings about those productivity standards. The other thing that can be challenging about that skilled nursing facility is the carryover of recommendations. So oftentimes in skilled nursing facilities, or as we call them, SNFs, staff is pretty shorthanded. They're busy. So if you educate someone on your recommendations, that information might not get passed along, might not get fully followed up on once you're gone. So keep that in mind. The other thing is travel. So oftentimes in skilled nursing facilities, you're working at maybe 1 to 3 facilities to make sure that you're getting those 40 hours a week. The adult outpatient clinic. So this is where I've been for the majority of the last 3.5 years. So typical day, you've got pretty set schedules. We see our patients for an hour-long session. I see 7 patients a day, lunch and some paperwork in between. So you're going to be seeing, Parkinson's, ALS, Huntington's, post-stroke, providing treatment for all those different areas. Median annual salary is about $77,000. Pros, you have consistent caseload. You're seeing these patients for 2 times a week for 6 to 12 weeks. So you really get the chance to establish relationships with your patients, which is a really neat part about the outpatient setting. You also might have the opportunity to have interdisciplinary approaches to care. At our clinic, we have PT and OT as well as speech therapy. So really working with those different disciplines in order to learn more and be able to treat your patients in a more effective manner. Cons, you do have a very set and rigid schedule. So when I go in for my day, I know exactly who I'm seeing and when. The other thing that can be challenging about that is having back-to-back sessions. An hour here, I've got 5 minutes between to prepare for my next hour. So it is fast-paced in a different kind of way. You're busy all day long. Other places that we as speech therapists can work. So I had mentioned in the introduction that you can work in some non-clinical roles as well. You could work in administration, so working as a clinical manager, higher education, clinical supervision, associate professors. You could be some kind of corporate consultant, work on training in terms of communication. You can also do that for government agencies, working on different contractual services. You can work in sales, representing different AAC companies or medical supply companies, or you could work in insurance as, say, an auditor of different people's notes, making sure they have and are doing everything they need to do in the clinical setting. So in summary, we as SLPs have many, many, many options that we can do. Very nice as you're working through, just to know that if you don't like one setting, there's other areas that you can go to. It is very important in your graduate school application process to identify what you're hoping to get out of work. Are you hoping to work with the adult population or more so the pediatric population? Because this will help really guide you in selecting programs that have clinical practicum opportunities that cater to your desires. And again, I think it's very important to get experience in each of these settings just to see, do I like working with adults? Do I like working with peds? Do I want to be in a hospital or more of an outpatient clinic? So I really encourage you to try to get some shadowing hours in before you even take that next step in searching for your different schools. The last thing I want to cover here is it worth it? So I want you, before you jump into your grad apps, which are quite expensive, to think through, is this worth it? Is this something that I really want to pursue? Things to consider: student debt. The average debt ranges from about $90,000 to $100,000 for a master's degree. That includes things like tuition, housing, transportation, food, all the costs of living that you can kind of anticipate. The other thing that you're spending is time. So the cost of time spent seeking the degree rather than being in the workforce. You're spending 2 years getting your master's rather than working and getting a salary. In addition to that, you're having your fellowship year, during which you're most likely not going to be making quite as much as you would once you're a certified speech pathologist. Additionally, there's a lot of stress. Graduate school comes with emotional, mental, physical stress. There's high expectations along the journey of grad school. You have a busy schedule. So just keep that in mind. The other thing to consider are your future goals. So what kind of lifestyle do you want to live? Do you really want to travel? Do you want to focus on your family? Those kind of things can help shape the different setting you want to work in, or maybe whether or not you want to pursue speech pathology itself. So in summary, is it worth it? Yes, because X, Y, and Z. You have to kind of fill in those blanks on your own. No, because of X, Y, and Z. Again, making that determination on your own, given that information that I've presented to you. Your carryover assignment for this week, you'll be looking at lesson 1 handouts, which we'll peek at here shortly. I want you to determine which 2 to 3 settings you would likely want to work in. Again, this can change based upon those things like pay, pros and cons, just what strikes your interest the most. I want you to Google search those settings within your area. So for example, if I was going to do this, I would look up adult outpatient clinic in Fayetteville, Arkansas. I then want you to contact one or two of those clinics via phone, email, whatever you want, and attempt to shadow an SLP for 4 to 8 hours, so about half a workday to a full workday. Rank your experience and your ongoing interest in that setting using the scale that we have in our handouts, and then request that SLP fill out a form just so you can get their insight in terms of what they like and maybe don't like so much about the setting that they're in. So let's go ahead. We're going to take a peek at those different slides. Let's see here. As we're transitioning, what I'm going to be showing you is going to be your Unit 1 handouts. Again, each unit will have these type of handouts to look at. You see here, I have a comparison chart going through all the information that we talked about today for each of those settings. We talk about the pay, pros and cons, just to have an organized view of what you're going to be considering when you're looking at each setting. As we go through next, we'll be seeing page number 2. What is an SLP? Where can I work? I go through and give you those resources where I pulled those numbers from the salaries, a cost of living calculator, and then different blog posts that you can see. This is what a day in the life of an SLP in each setting looks like. Page number 3 contains your homework assignment and kind of a different how you can scale your interest based upon your experience in a clinical observation encounter. I do want you to note too, with COVID-19 restrictions, it might be that people are not able to let you come shadow. Still have them try to fill out this form if you can. Here's an email template or a phone script that you can use as you're inquiring about shadowing. And then we end again with that survey you can present to that SLP. So I hope that you find these resources helpful. Again, as always, feel free to shoot me an email at preparedslp@gmail.com if you have questions. And I look forward to seeing you in Unit 2. Thanks so much.